Hello, good afternoon, dear audience, dear chairs. My name is Galdzytska, and I would like to share with you my current progress, my stage of my PhD, that is the role of chronic systemic inflammation in the cardiovascular pathology. So I'm a PhD student and also the medical doctor, and I came here at the CTM with a vision to improve approaches to the diagnosis and treatment of patients with chronic systemic inflammation. To achieve that, we with my team has a mission to study inflammatory biomarkers and their role in the patients with chronic inflammation. Nowadays, I have two specific goals. Both of them are conducted with the methodology of systematic review and meta-analysis, and both were started in fall 2023. So let's start from my first project, that is investigating the role of inflammatory biomarkers in the development of adverse cardiovascular outcomes in patients with coronary artery disease. So inflammation has been proven, having been involved in the atherosclerosis and through their atherothrombosis. And inflammatory biomarkers is a huge group of the molecules that include different cytokines, chemokines, immune-related cells, acute phase proteins, and so on. The problem is that the biomarkers evaluation has not been integrated into the routine clinical practice and don't use in the clinical in the clinic nowadays. So our aim to use the inflammatory biomarkers as a risk assessment for the cardiovascular outcomes. The clinical question for this project is, do inflammatory biomarkers play a role in major adverse cardiovascular events in coronary artery patients? For this, we have PFO framework, where we have two subgroups of the patients with chronic coronary artery disease and also with acute coronary heart disease. The factor is inflammatory biomarkers, and the outcome are MACE that include mortality, acute coronary syndrome, heart failure, hospitalization, revascularization, stroke, and so on. Our hypothesis is that patients with higher level of the biomarkers have higher risk of these MACE events. The clinical result implication of this study will be improvement in the diagnosis and risk assessment of these patients. We conducted the systematic search in 3 databases in November 2023, and you see it consists of 2 domains. This is our flowchart of the selection. We were starting from more than 40,000 articles at the beginning, and after the full text selection, we end up, and we crucially decreased this number to 631 eligible full texts, and however we also reached some of the papers after the emailing and asking for the request at the ResearchGate. So the summary of this investigation, that we have more than 129 biomarkers, and here you can see the summary of how many approximately of each biomarker we have in the papers. And I would like to share with you some plots that we've got at the end as the final results. So first one is association of interleukin-6 with the MACE in patients with acute coronary syndrome. It involved nearly 6,500 patients, and their study population won from the papers that were prospective observational studies, and also some of them were secondary analysis of the RCTs. So as you see, the outcome measure here is a hazard ratio with a 95% confidence interval, and the overall effect for this population is clinically and mathematically significant. It has 1.70. That means that patient with increasing level of the interleukin-6 has 170 times more likely to have MACE. The second figure is association of interleukin-6 and MACE in patients with chronic coronary disease, and here also we reach the significance. As you see, the result overall effect is 1.48. Figure 3 showed the association of another interleukin, interleukin-10, that is anti-inflammatory interleukin, and its association with MACE in patients with acute coronary syndrome. And I think this plot is quite interesting because, as you see, the overall effect is 1. That means that basically for patient, half of the patient would have the negative association, and half of the patient has positive association. For the patient with from the Hishin Jung 2022 and Jung 2016 were reported usually more mild evaluation of interleukin-10 that associated with more mild course of the disease, and the patient with more significant increase of interleukin-10 that shows more acute, more strong inflammatory process usually leads to more often MACE. Figure 4, it's about the PAP-A biomarker that the biomarkers that the biomarker that usually can be elevated normally in patients during the pregnancy, so in pregnant women, but however, during the inflammatory process, it can be also evaluated in non-pregnant individuals. So this association shows that the patient with elevated level of the PAP-A has also higher risk of the MACE in patients with acute coronary disease, and also in patients with chronic coronary disease. It's almost 2 times higher. So the current stage of my first project is the data extraction. I already extracted the data from around a little bit less than 300 articles, and this is 36.6%. My second project is investigating the role of inflammatory biomarkers in the development of in-stent restenosis in patients underwent percutaneous coronary intervention. So we know that PSI, the percutaneous coronary intervention, nowadays kind of the standard of care, and it's performed more than 900,000 this performance every year in only United States. In-stent restenosis still becomes quite a serious problem. It's achieved around 7–10% after each procedure. The role of inflammation in this development of in-stent restenosis is clearly demonstrated. You can see it on the picture, for example, pathogenesis of this process, and residual inflammation. It's kind of the modifiable pathogenic factor potentially, but again, it wasn't investigated clearly. So our aim to investigate the association between elevated inflammatory biomarkers level and recurrent restenosis after the PCI. The clinical questions that were raised due to this problem is, do inflammatory biomarkers increase the risk of in-stent restenosis in patients underwent percutaneous coronary intervention? We also have PFO framework for this, where the P is patients underwent the procedure, the F is inflammatory biomarkers, and we have 2 outcomes. The main one is the incidence of in-stent restenosis, and the secondary is the MACE, that's also the composite outcome. Our hypothesis is that patients with elevated levels of inflammatory biomarkers have higher risk of in-stent restenosis after the procedure. The implication of this study will be potential novel treatment strategies and, of course, monitoring of the patient after the PCI. In summary, I have 2 ongoing projects. Mainly, I was focusing still on the first one, and I hopefully submit this paper this year. So thank you very much for your kind attention, and I would like to end my presentation with my favorite quote, "Keep your eyes on the stars and your feet on the ground," by Theodore Roosevelt. Thank you.
Thank you very much, Nina. This was a huge work, and it's still an ongoing work. But by the complex exam, I think we are going to have an astonishing manuscript. Actually, I really enjoy the connection between the first and the second study, because we are talking about modifiable risk factors. Some biomarkers, perhaps, are more causatively associated with MACE, and some biomarkers are more correlating with MACE. In the studies that you have overlooked, were there any signs that perhaps trying to reduce some of these inflammatory biomarkers would directly or indirectly help these patients with acute or chronic coronary syndromes? In a shorter sense, do you think, based on the literature, anti-inflammatory treatment can also help acute or chronic coronary syndromes?
Yeah, thank you very much, Jenner, for very interesting questions. So, of course, inflammatory process itself leads to the MACE, and we would like to, so the main goal of the project, of course, to evaluate the biomarkers as a risk assessment. However, there are, many trials ongoing that trying to influence on the level of inflammatory biomarkers to decrease the level of inflammation through this and to decrease the risk of the MACE and in general atherothrombosis. So I would say yes, theoretically talking, we have this kind of correlation, but we can't see the direct correlation at all. So we are talking in this study about the association only. Yeah, I would say so biomarkers show us the level of inflammation, and we know the atherosclerosis it happens due to inflammatory process itself. So yeah, there might be correlation, but it's not proven yet.
Congratulations for your work. My question is, what do you think, what are the underlying conditions, the inflammatory factors? What can cause these factors? Practically, what patient I should care more, for example, diabetic patients, but you mentioned pregnancy as well.
No, pregnancy wasn't mentioned. Well, yeah, pregnancy increased the level of thrombosis in general. However, we are talking in this study only about coronary artery disease. Nowadays, from the, again, from the clinical point of view, this is a part of inflammatory process. And any kind of inflammatory disease can lead to increasing level of the MACE. In general. Actually, this is a very good question because my initial idea was to implement evaluation of the inflammatory biomarkers in general, not only related to the coronary heart disease, but in general due to inflammation. And the name of my study, of my PhD, I mean, it's systemic inflammation. So any kind of inflammatory process potentially that increase the level of the biomarkers, inflammatory biomarkers can lead to MACE. So in general, it can be a good ground, I would say, background for their further investigation in the relation of other inflammatory diseases, not only coronary heart disease. So diabetes, rheumatoid arthritis, any kind of systemic inflammatory diseases. Yes. So.
Is it imaginable that there will be a significant or exact level of specific biomarkers that in case necessary the reconography before the symptoms, for example?
Yes, thank you very much. Actually, another potential usefulness of our study is to predefine maybe or even somehow predict the cutoff for each biomarker, and we would like to focus on that as well. But currently I can't answer about each of the biomarker, but yes, thank you. We would look at that as well.
We have time for one short question. Anyone? Then I'm going to ask you that we could see extensive literature about these topics, and my question would be if there is any specific inflammatory biomarkers that is strongly recommended to examine during the patient with a high risk of MACE.
Yes, thank you very much. So currently only CRP was proved as and involved in the evaluation for the patient with coronary heart disease, and also with the patient with inflammatory disease, for example, again, itself rheumatoid arthritis. And the point that it's not usually, so it's very broad biomarker. It can relate it to many different risk factors. So therefore, we would like to investigate some more specific, and that again bring us to the list of numerous list of different biomarkers that maybe will be much more specific. So CRP nowadays, what we will end up, we will see.